Hey, Christian caregiver. Welcome to Christian Dementia Caregiving, the podcast for Bible-believing Christians who are wanting to make their dementia caregiving journey easier using our God-given talents and strength and giving you hope and help for the future so that you can continue to create moments of joy and ease your burden during your caregiving. Today, we have a very special guest on the podcast. His name is Dr. Ramon Pino, and he is a upper cervical chiropractor. And our conversation is around how upper cervical chiropractic care can potentially help a person living with dementia, as well as the caregiver of somebody living with dementia. If you haven't yet joined me for one of the free monthly coaching opportunities where you can come onto the podcast and have a 30-minute conversation with me related to your specific dementia caregiving challenges, I invite you to sign up for one of the monthly slots that we have by going to the website and by messaging me the word audit on Facebook or on Instagram. So message me just the word audit on Facebook or Instagram to grab the one time a month free coaching opportunity where you can have your own dementia caregiving situation discussed and set you on the right path for your future. But without further ado, let us dive into today's episode, how to prevent caregiver burnout using chiropractic care. Well, welcome, Dr. Ramon Pino. Thank you for being here today on Christian Dementia Caregiving. I am very excited about this conversation because for a couple of reasons. Number one is we know one another personally. Number two is I've never had a chiropractor on this program. And number three is I don't know that much about chiropractic care and how it can help either the families of people living with dementia or perhaps somebody living with dementia themselves. So Ramon, why don't you go ahead and introduce yourself, tell people a little bit about yourself and your background, and then we'll get into this.
Yeah, thank you for having me. It's been a long time coming. My name is Dr. Ramon Pino. I grew up in Winston-Salem, North Carolina, and I practice with my fiance, Dr. Marion, in Mauldin, South Carolina. We own Clarity Chiropractic, and we take an approach to chiropractic very differently. We believe that, first of all, chiropractic should not hurt. So we make it very gentle. And then we also focus on the upper cervical spine, just because when I came into chiropractic, that's kind of what introduced me to it. I had a mentor who did upper cervical chiropractic, and then that's kind of all I knew going into school. So I dove deep into it. And just the results from upper cervical chiropractic is super fascinating. And then obviously the science behind it, and then the way the technique goes. It's very gentle. It's very minimalistic, I would say. There's not a lot of adjustments, and people really, really, really see crazy results. And that's ultimately what got me into it.
Wonderful. So why chiropractic specifically?
Yeah, so when I was in high school, I didn't really know what to do, what I wanted to do with my life.
Didn't know who you wanted to be when you grew up?
No, I didn't.
I still don't know who I want to be when I grow up.
So I was pretty good at math. I was always pretty good at math throughout middle school and high school. So I thought, why not do something in engineering? And I had construction background with summer jobs and that kind of stuff. I went to the University of North Carolina in Charlotte, and I went into the engineering program. And I took the first semester of engineering, and I really did not like it at all. I didn't like the amount of paperwork engineers had to do. I didn't like the fact that you would always have to listen to somebody. Like, you would always have a boss. It was really hard for engineers to start their own firm, essentially. So I said, scratch that. Let me go back to the drawing board. And I switched over to exercise science.
Okay.
In exercise science, I had the idea to be a physical therapist, personal trainer, physician's assistant, a PA. And then in our introduction class, we had multiple people from those fields come and speak to kind of talk about what you can do with an exercise science degree. And in one of those, we had a chiropractor come by, and he pretty much told his story, how chiropractic essentially saved his life. He was a football player in high school, quarterback. He was playing his junior year, and he got hit in the back of the head, and he pretty much was paralyzed. It was a very severe injury, got hit in the back of the head. And then he did physical therapy for about 6 months, and he was able to start walking again. He said he couldn't play football anymore, obviously. And then he was playing basketball, and he was going down to stretch. He went down to touch his toes, and he just felt that same shooting pain go up his spine, and he was paralyzed again. So 6 months of physical therapy, essentially went down the drain. He had to restart all over again. And you got to think about, the situation that this young man was in. He was pretty much a student athlete his entire life. His parents were obviously very invested in sports. And I remember when he told the story, he was like, I felt like I lost my identity. He's like, I didn't know how I was going to make my father proud because he went from being such a good student athlete to now being
Mhm.
paralyzed. And then someone from his church told his father to go see a chiropractor. So they went to the chiropractor, and after a few weeks of care, he was able to start walking again, start working out, and essentially he was able to play his senior year of college football, and then he was actually able to go on to play at Campbell University as a quarterback. So I heard that story in my intro class, going from engineering to this. I was like, that is crazy. So I went and shadowed his office. And as soon as I walked in, he was walking out with another patient. Very similar story. This man was in the military. He had a spinal injury, and he pretty much got medically discharged because he could no longer serve the military.
Mhm.
We went to Dr. Tim, and after a few sessions of upper cervical chiropractic care, he was able to start working out again. And I remember he told me, he was like, I got my life back. And he was now playing semi-pro. The patient of his, from being discharged in the military because he couldn't function, essentially,
Mhm.
to being able to come back and get his life back and actually play semi-pro football, was really, really cool to see. So that's when I was like, all right, I want to do this for a living. I want to do this for people, because if you can change someone's life without having to do surgery or without having to do this crazy medical procedure, it's just simply adjusting the spine and help people get their life back. I was like, that's what I want to do. So that's essentially what got me into chiropractic. And then going to Sherman College, I mean, it was obviously a big investment, so I went all in, and I went to numerous seminars, numerous talks, shadowed multiple offices, and really, I guess you could say, I grew my passion for chiropractic.
Mhm.
So that's why I do it.
So upper cervical is different than the other type of chiropractic care, correct?
Yeah, I would say it's pretty different. It's a little more complicated. It's a little more harder to master. Definitely the technique. So traditional chiropractic, what we learn in school and what most chiropractors do, is they adjust full spine, and they typically, they adjust one side of the neck, then they adjust the other side, and then they adjust like multiple segments in the thoracic spine, and then they put you on your side, and they do one on one side and one on the other side. And that gets people well. That obviously helps, but you always have complicated cases that don't get well. And that's
Mhm.
essentially how upper cervical chiropractic began. Um, it started with, let's look at where the neurology of the nervous system starts, right?
Okay.
And your brain isn't obviously in your head, and then you have a brainstem, which is
Mhm.
essentially the command center for the entire nervous system, and it sits in between. And we could probably add a graphic to this, but it sits in between C1 and C2, which are
So for people who are only listening, when you put your finger at the base of your skull, you got that little divot
yep.
at the base of your skull, right? That's where you're talking about.
Yep, that's where your brainstem starts. So right where you feel I guess the hardness of your
Yep.
skull fall off,
Yep. Right
and
there.
you feel that soft tissue right there. That's where your brainstem is actually housed.
Mhm.
And obviously your head has a lot of mobility, increased mobility. You're able to turn your head, look up, look down.
It's a good thing.
Yep, check your blind spot.
Or else you shouldn't be driving.
Yeah, but what I tell people is, with increased mobility comes decreased stability.
Mhm.
So that part of your upper cervical spine is only held together by soft tissue. So it's muscles, tendons, and ligaments.
Yeah.
So
That should scare everybody, right?
yeah, yeah. No, I mean, it truly should. Because if something happens to you, something traumatic, whether it's an accident, whether it's a fall, even when you were a kid, when you come out of the birthing canal, they're pulling on your neck, especially C-sections, your body has a hard time putting that bone back into position because it's only held together by soft tissue.
Mhm.
So upper cervical chiropractors really focus in on that area just because it's so vulnerable to misalignment. And we take specific x-rays of the neck, and then we also track it with how your nervous system is responding to care with the neurological scans that we do in the office. And we focus on making a precise adjustment to that upper cervical bone. And it can be very gentle. It doesn't require much because it's such a small bone, and
Mhm.
any little misalignment, millimeters of misalignment, can cause um, a lot of things to happen in your body. So that's kind of the approach that we take. That's what upper
Mhm.
cervical care is.
So, when people are struggling, what kind of people are coming to you that benefit from the upper cervical stuff? Is it like headaches, or, what kind of symptoms or problems are people having that you've experienced have the best results?
Yeah, that's a great question. I would say that obviously everybody benefits from cervical chiropractic, but I think some of the more delicate cases that we would see come in the office is people who have chronic migraine, and they've been to multiple medical through multiple medical routes, and they've been to the ENT, they've been here, they've been there, and they can't really get an answer for why their migraines
Mhm.
go away. That's one of the people that we really see great results with. Dr. Marion was actually one of those people. That's what got her into chiropractic, is that she had very debilitating migraines, and to migraines to the extent where like she had to be in a dark room for the whole day so it wouldn't hurt as bad. But essentially, we have those kind of people come in, and then we analyze their spine, and they typically have a pretty bad misalignment in the upper cervical spine.
Hmm.
Then their cervical curve is definitely affected by that misalignment. So it creates a lot of pressure in the head, a lot of muscle tension right at the base of the skull,
Okay.
and that's what's firing the signals to your brain to essentially tell you that something's wrong, and that's what causes the headaches, the pain. So once we correct that misalignment, those people respond very, very well, and
Hmm.
we actually a young lady come in about 2 weeks ago who had those type of crazy migraines. She actually had a migraine that day when she came into the office for her adjustment. We adjusted her, and then later that day the migraine went away. So it's
Hmm.
very, it's very, very successful with those kind of people.
Okay. And does it last like for a long time, or does it, does your body go back into the same pattern again and then you get another migraine? Or is it like very specific each person?
That's a great question. I think it depends very much on the person as well. Everybody's different. Obviously, it's not a
Sure.
cookie cutter procedure. I would say your body will go back to what it's comfortable with, right?
Hmm.
Humans are creatures of habit. We like to find a routine, and we like to stick to that routine. Same thing with your body. Once your body finds a position that it's been in for a long time, it'll stay that way, and it'll want to go back to that way. So we always recommend that people stay on a consistent care plan, because if we adjust you and your body's in this new position, and then it's like you go back and you do the same thing that you've been doing, for whether it's the same job, whether it's the same hobbies that you have, your
Hmm.
body's going to go back to that state. So we always tell people to come in at the beginning consistently, at least twice a week, to kind of adjust you, and then see how your body responds to it, and then check you again. It doesn't mean we're going to adjust you every time you come in, but at least check to see how your body's holding that adjustment, because more than likely it will go back to what it
Okay. So
was.
tell me a little bit about what the research shows, or what the benefits for somebody maybe who has mild cognitive impairment or the beginning stages of dementia, how upper cervical can potentially help from a science background, right? The
Yeah.
science behind it. I mean, you and I've spoken about it a little bit, so
Yeah.
I want other people to understand, what kind of benefit it could potentially give someone.
Yeah, it's a great question, and I remember when we first met, I was like, "Oh yeah, this is right, we're right down my lane." So essentially, kind of like I mentioned, up in the upper cervical spine, you have a lot of neurology, a lot of arteries and veins that feed the brain. Right, the brain needs blood. The brain needs to get drained from the CSF, that's cerebral spinal fluid, that's in the brain, and that all runs through that atlas bone. Right, so the upper cervical bone, there's the internal jugular, there's the vertebral artery, and then there's the carotid artery. They're all within that region. The vertebral artery actually runs through the atlas bone.
Right. So
Um,
for people listening, all of those things come up in through your neck.
yep, exactly. Yep, and the vertebral artery is one of the main suppliers of blood to the brain,
Hmm.
and it runs through literally through the little holes of the bone in the cervical
Yep.
spine. It runs up through there, and then it goes into the back of the skull into the brain,
Right.
and then
So if you have, I want people to imagine, the way our spine is designed, make two fists with a little bit of a hole between them. That's where your spinal cord goes through, but then you've got other holes in your bones that let the the arteries and nerves come through too. So if there's just a little bit of a turn, it's kind of like pinching a telephone cord, an old-timey telephone cord, and the messages aren't getting through.
yeah. Or we always like to use the water hose analogy.
Right.
There's a little kink in the water hose. You're still getting water flow, but it's not optimal water flow that you would want. And there's a lot, you see the models online, and you see, the graphics, and it only shows the blood vessel running through there. But it's actually, there's a blood vessel, there's the nerve, there's the vein, and then there's also fatty tissue, and then there's
Hmm.
dura. The body has all this stuff that protects it. So any little misalignment could put pressure on that blood flow going to the brain, and that affects obviously the ability to get blood flow to the brain.
Hmm.
But more importantly, cerebral spinal fluid in the brain, right? That's like, I guess, lubrication for the brain
Yep.
to make sure that it's nice and
Kind of
hydrated.
the wash that keeps
Yeah,
everything moving up there.
yeah. And obviously, essentially, you're washing the brain, and you have to drain that, right? You have to drain the waste that's
Yep.
happening with neural activity in the brain, and that gets drained through the internal jugular vein, right?
Hmm.
internal jugular vein, it runs in front of the atlas bone. So you have your neck, and then you have your throat up here. It runs right in front of the atlas bone. So if you have any rotation on the atlas bone, it can add pressure to that internal jugular vein, and that decreases the amount of CSF that can get drained from the brain.
Hmm.
And then we know that one of the leading causes of dementia is increased buildup of CSF in the brain, increased
Hmm.
waste products like the tau proteins and the tangles.
Right.
So when I was at Sherman College, I went to an upper cervical symposium in Tampa, Florida, and one of the professors at Sherman, she actually does research on how upper cervical chiropractic affects the drainage of
Hmm.
that CSF fluid, the lymphatic system, essentially.
Right.
And
How we
she
take out the trash in our head,
Yeah.
right?
Yeah. And it's very crazy to see how the positioning of that atlas bone can affect that. And then they teamed up with a doctor in New York. His name is Dr. Scott Rosa. If your listeners want to look him up, his research is incredible. He does what's called an upright MRI. So typically, when you get an MRI, you're laying on your back. So that's not ideally how we spend most of our time, right? So what he does is he does an upright MRI. So you're sitting in a chair, and he takes an MRI of your brain. And with an MRI, you can see bone, you can see soft tissue, you can even see the CSF flow pumping, and that kind of stuff. So on an upright MRI, the CSF fluid, it looks white. The color of it is white, and he would take an image before and after the adjustment.
Hmm.
You can see it in his research. It's incredible. Um, you can see the buildup of CSF flow, especially at the base where it's supposed to come out.
Hmm.
And then he does the upper cervical adjustment, and then he takes one immediately after the adjustment, and you can see the drainage. You can see the drainage happening. So if you know, I like to think, if anything, upper cervical chiropractic is is incredibly important for your health, but it's for people who are on the fence of starting to develop cognitive issues. I think it's crucial to prevent it from getting worse.
Hmm.
I think it can really help you from getting worse for that reason itself, because
Right.
the research shows that the cause of dementia is the buildup of those plaques and the tau protein. So if we're able to increase the drainage, increase the blood flow to the brain, and it's
Right.
just a better filtration system, I think.
So it's twofold, right? It helps to potentially increase the blood supply to the brain if that's what the mechanism is that's causing the blood flow not to be there, right? I mean, some people have plaques in their arteries and things like that, which obviously it could help, but it's not going to solve the entire problem. So it's both increasing the blood supply, which we need blood supply to our head in order for us. That's one of the big reasons why people have vascular dementias. They're not getting enough blood supply to the brain. And then also it takes out the trash by opening up the ability for the cerebral spinal fluid to drain back out of your head. For people listening, one of the things our body does, and this is one of the reasons sleep is so important, is when we sleep, that's when our brain takes all of literally the trash out into the cerebral spinal fluid that is supposed to be drained overnight. And that's why it's important for people to sleep and to sleep well so that this mechanism can occur. So what about caregivers? What about family caregivers? How can upper cervical perhaps help them? Because based on our conversations, right? People who are family caregivers are extremely stressed. They're overwhelmed. They, carry a lot of tension, all of those different things. So let's turn the conversation to how upper cervical can benefit a caregiver, not just a person living with dementia.
That's a great question. Obviously, people in that situation they have increased levels of stress, and it might be something completely new for them, and it's something obviously emotionally draining too, because to see a loved one go through that could be hard on the body. But what we've seen in the office, when people are in a high stress state, it's very hard for their body to one take in anything new, right? And if they have like a stressful day in traffic, then it's going to be way more dramatic than it would if you weren't already in that stress state.
Hmm.
If you had an injury where you hit your head, your body has a decreased ability to adapt to that because you're in this high stress state. And then also when you get home, when you get home, you want to be able to rest. You want to be able to, the day ends, you want to be able to get good sleep to prevent to get the proper drainage. And some people, when they're in a high stress state, they can't turn it off. They can't turn off that
Mhm.
stress out state, and they can't get the adequate rest and recovery that they need. So in the office, we have a device. It's called our HRV, heart rate
Heart
variability.
rate variability. Yes.
And essentially, it'll test your nervous system to see where it's at rest, whether you're in the fight or flight stressed out state or whether you're in the parasympathetic rest and recovery state. And ideally, we want to see people balance between both. You need both systems, right? If something happens, you need to be able to quickly. And then also, when you get home, you need to be able to digest your food, get adequate rest, let your body recover from everyday life. So that scan will tell us whether you're in that sympathetic state or that parasympathetic state. And most people in this day and age, they're more than likely in the sympathetic state. And then what we've seen is people who have been in that state for a long time. The scan will also tell us if your energy reserve systems in the nervous system are low, and that's typically when people are in that fatigue state. They're super tired. They feel like they wake up and they still feel tired when waking up.
Mhm.
They're sleepy instantly at lunchtime.
Mhm.
They can't stay awake for a long time. So I would say a misalignment in the spine. Let's rewind a little bit. So your nervous system runs through the spinal column, right? It runs
Mhm.
bones like we talked about earlier in the podcast. It runs through the holes in the bone, to keep it simple. And again, there's a lot of stuff running with it. It's not just the spinal cord. There's fatty tissue,
Right.
there's veins, there's arteries. So any little misalignment can put pressure on the nervous system. And what does that mean? It means that now your nervous system itself is under stress. You might not be stressed out, but your nervous system is. And your nervous system controls everything. It controls everything in your body. It's the electrical system of your body. So if your nervous system is in a stressed out state, your five senses are controlled by the nervous system. So if it's already stressed out, the way you perceive the world is a little more difficult. And it's not
Mhm.
right. Something so small could cause you to get irritated or flip out, or you can't react as quickly to things like that. So I would say a misalignment in the spinal column can create a lot of pressure to the nervous system, and
Mhm.
that's you see the people stuck in that sympathetic state. So with upper cervical care, with chiropractic care, we make sure that that pressure is removed from the nervous system and make sure that your body can perceive the world the way it's meant to be. And we use that scan to track it throughout care. So
Mhm.
not only do we want people to feel better, we actually want your nervous system to be at an optimal state so you can adapt to whatever life throws at you, especially for people that are under a different situation emotionally and that are having a little bit more patience with their loved ones. So I know that's how chiropractic can help those people. It's just calming down their body. And then
Mhm.
I think also a very important part too is the education behind it.
Mhm.
Something that I've seen in our office is that when people learn how their body works, they're more aware of it. They're way more conscious of it, and they can make better decisions.
Right.
And they can understand, like, if I'm having a bad day, when I get home, I'm just gonna relax. I'm not gonna try to do the chores in the house. Like maybe I just need time off. Maybe I just need to sit down. I always tell people the more time you can spend outside, the better. Because if we're always inside and you're stressed out, it's like it just builds on top of each other. So
Right.
I think
Yeah.
the awareness of how your body works really helps people a lot too.
Right. I totally agree. I think the awareness of how your body works, and then even taking it one step further, is how we are thinking about our situation and what we're contending with, and because if we're constantly thinking all of these negative thoughts, etc., it has an impact physically on our body. And we forget that. We think our body and our thoughts are separate of one another, but they very much, very much impact each other. So I agree, getting outside. Outside is so therapeutic, both for a person living with dementia, but also for the family caregiver. Just taking somebody with dementia outside first thing in the morning, having the sunlight hit their eyes, helps reset their body clock. It helps them sleep better at night. There are just so many benefits to that in being outside. And yeah, we spend way, way too much time inside. A lot more, than what we realize. And so, yeah, I really appreciate you mentioning that for people to go outside. And I think you bring something very valid up that we also don't really honestly think about all that much. Is a lot of people are so task driven, right? We've got to get all these things done, and we believe that we got to get them done now. But there really are very few activities that we do on a daily basis that can't wait, right? One of them that cannot wait is if you're naked and wet, you got shampoo in your hair, you're committed until you're done, right? And then some baking activities and things like that once you get started, you can stop, but it'll flop, right? So but we have this tendency to think or believe we have to do things now. I have to come home and then I have to do this, I have to do this, I have to do this, instead of just stopping and breathing. And I know for myself, that has been one of the biggest changes in my life as I stopped working full time, where I was constantly in this thought process of task driven, do this, do this, do this, do this, do this, boom, go bed, get up, do it the same thing the next day. Life has gotten so fast that people are not taking time to just breathe.
Yeah, absolutely. I mean, and like I said, it may very well be due to an increased stress state that you're in, right? And it's a never-ending cycle of, if I don't get this done, then it's going to be more on me tomorrow, and
Right.
it goes on and on and on. And if your body is perceiving everything that way and it can't turn it off, then you you literally will never stop living like that. So
Right.
the responses after an adjustment in the office, especially with the upper cervical ones to the neck, people always get off the table and they're like, I just feel so calm. I just feel relaxed. I feel loose. Like I can go to sleep. So, your nervous system is very important. I think it's one of the most important things that you should prioritize with your health, and because it controls everything, like I said before. So if that's under stress, you're definitely going to be under stress.
Right.
I think it's super.
Our nervous system is the control and command center. It's the computer that runs our body, for sure.
It controls your thoughts.
Yep,
It controls your physical, all that stuff.
for sure. Hormones, everything. I mean, literally everything is controlled by our nervous system. So a lot of people listening are not necessarily in South Carolina, but we do have some people who live in South Carolina. For the people who are not in South Carolina, if they want to know more about upper cervical, more information, where would you send them? I know you do a lot of education. Do you have some education on your website that people can learn more about upper cervical? Where would you have them go? Is there a specific spot?
Yeah, so I would say a good place to look at the research that I was kind of talking about is, it's just a great organization. It's called the Foundation of Vertebral Subluxation. It's a great group of people that run that, and they have a bunch of research related to chiropractic. That's a good place to start to look at the research, and then
The foundation of,
vertebral subluxation.
okay, and we can put a link in the show notes.
Yep, and that'll give you. It's a website that has almost like a search bar for whatever you want to search regarding chiropractic, and then specifically Dr. Scott Rosa. He's the one that does the upright MRIs, and I think there might be no. They took that video down. There was a video on YouTube that explained a little bit about what we just talked about, but it's such a life changing thing that unfortunately people in power don't want that out there, and they start to take it down. But also, if you're looking for an upper cervical chiropractor, I would say upper cervical chiropractors, they educate, almost all of them educate their patients, because it's super important for people to know. So if you're looking for an upper cervical chiropractor, there's a website. It's called uccnearme.com. And I think you just go on there, you put in your zip code, and it'll show you the closest upper cervical chiropractor near you. And then when you go in there, just go in there with all questions that you have, and then they'll be happy to answer it. That's a great website that one of my good friends created,
Oh,
because
wow.
he saw the need, because he would make really great videos on Instagram and TikTok, that kind of stuff, and people would always ask, like, where can I find a chiropractor like that near me? So he created this almost like this page
Mm-hmm.
where upper cervical chiropractors, they put their
Directory.
yeah. So
Awesome.
that's a good place to start too.
And now for people in South Carolina who might be listening, tell them where they can find you locally.
Yeah, so we're located in Mauldin, South Carolina. It's a little bit south of Greenville. It's pretty much Greenville now.
Yeah, it's pretty much Greenville.
Well, you can look up our office. It's claritychiropracticsc.com. That's our website. And then that's where we're located at. We love taking care of people. Lizette's been there. And
I have
it's
been
great.
there for sure. And you guys do a phenomenal job of taking care of people and even educating people who know a lot. So
Yeah.
I'm really glad that you take the care and the time to actually spend the time with your clients and teach them what they need to know. And if you do live local and you do go visit or reach out to Ramon, do tell him that you came there from me, because that way we can keep track of whether or not, we have referrals just off of the podcast coming towards him, because part of the purpose of the podcast is both to educate, but both, to help educate people, but as well as actually get people the help that they need. So
I would like to add too that it's myself and Dr. Marion. She practices upper cervical as well, and we've noticed that female patients that come to the office, well, we always refer them to Dr. Marion because there's this connection with a female to female interaction. It's way more. They can get way more into the girl talk and that kind of stuff. So it's way more comfortable for them. So the listeners as well. Like I do upper cervical care, and she does it as well. And I think it's super important for the patient to be comfortable with their practitioner.
Absolutely. And I'm gonna tease you again because I tease you all the time. You got stuck with me and I didn't care, right? Poor Ramon had a lot of female conversations with his female patients. So
And people, just to make people, create a welcoming environment. We like to take that approach to the way we run the office.
absolutely. You guys have a very welcoming environment. Well, Ramon, thank you so much for taking time today and coming on the podcast and educating us about upper cervical. You are one of the first, people from our group that I've had here. I'm still working on a couple of other people that I want to bring on the podcast. So I really appreciate your time, and I really appreciate you being willing to educate people, like truly educate them as to the benefits, specifically both for somebody living with dementia, as well as somebody who is their caregiver, because I do think that this brings value to people listening. So thank you very much for being here today.
Of course, thank you for having me. And I would like to add, if you notice that people have certain specific questions that are coming up more commonly, I'd be happy to come back on and answer them.
Awesome, for sure, absolutely. Well, you have an open invitation to come educate us about anything related to brain and brain health.
Yeah, and that's our passion, right? We set out to educate the most we can, because if people don't know, then they'll always
Yeah.
be in the dark. So
Yeah. Well, I can tell you, in at least related to the podcasts and places that I've listened, I don't ever remember hearing somebody talk about upper cervical care for dementia patients.
yeah,
So hopefully we'll get a lot of attention from this. I'm hoping.
yeah. They can change your life. So
Absolutely, it can change your life.
thank you for having me, Lizette.
You are very welcome. Are you feeling stressed as a Christian dementia caregiver? Let me help. I offer a monthly dementia care audit to one listener of this program to provide you with personalized but evidence-based strategies from a biblical perspective. We only have one session available each month. Don't miss this opportunity to make your dementia caregiving journey easier. Schedule your own dementia care audit today.